Kick-ass facts, pew pew pew! Time once again to talk about weird medical shenanigans. A male patient was screened for metastatic cancer and the lab results came back pointing to an ovarian primary tumor. A biological male with ovarian cancer. They thought there was a mix-up, so they reran the tests. Same result. Turns out, this guy had a liver transplant years earlier and the female donor had undiagnosed ovarian cancer that had metastasized to her liver. Once transplanted, the cancer basically exploded inside of him because of the immunosuppressants, keeping his immune system in check. Another transplant horror story, a 14-year-old donor was believed to have been perfectly healthy, was actually harboring synovial sarcoma, a rare and aggressive cancer. This sneaky little tumor got passed on to 3 different people through a liver and 2 kidneys from the same donor. Within months, all 3 developed donor-derived tumors and had to go through intense treatments or have the grafts removed. I'm an organ donor. I will apologize in advance at anything that happens to you after you get my shit. Stub your toe, bite the inside of your cheek, that's on me. Body integrity identity disorder. Imagine feeling like one of your perfectly healthy limbs does not belong to you, so much so that you have an overwhelming and persistent urge to amputate it. It is a disconnect between the brain and the body, almost like gender dysphoria, but for your limbs. One patient was so desperate to lose a leg and doctors wouldn't remove it, that they submerged it in dry ice for 7 hours straight. Torture. They forced doctors to amputate it. The leg was literally frozen solid and made a knocking sound when tapped. Stevens-Johnson syndrome, SJS, is a skin reaction usually triggered by medications. It starts like the flu, but gets nasty pretty quick. Painful rashes and blisters. The top layer of the skin dies and sheds off, leaving raw, exposed skin underneath that can take months to heal. In its most severe form, toxic epidermal necrolysis, called TEN, covers 30% of the body. If you ever get diagnosed with this, the culprit drug must be avoided forever. Here's a gynecological nightmare, hematemetra. Imagine never having had a period, but feeling all the monthly cramps and bloating because your uterus is slowly filling up with years' worth of blood. This happens when menstrual blood can't exit the uterus, often because the cervix is blocked or malformed. There was a case of a 16-year-old girl who had severe abdominal pain and no period history. Imaging revealed a massively enlarged uterus packed with blood. Surgery drained nearly a liter, and then she started menstruating normally after that. A supernumerary nostril means being born with an extra nasal opening. Fewer than 50 cases have been recorded, and it usually appears next to or above normal nostrils. Sometimes it's actually a tiny sinus tract or dermoid cyst masquerading as a nostril, but occasionally it is a true extra nose hole. Mostly cosmetic, but surgery is usually recommended. Chorea, a movement disorder that's like your body's throwing a spontaneous dance party you didn't know you were invited to. People with chorea experience sudden, unpredictable jerks and twitches that flow from one muscle group to another, often affecting the face, hands, or feet. Causes range from Huntington's disease to infections after strep throat, autoimmune issues, medications, or brain injuries. Treatments focus on the cause, but often involve medications to calm the chaos. Fibrodysplasia ossificans progressiva, FOP, is also known as Stone Man syndrome, an ultra-rare genetic disorder caused by a mutation in a gene that controls bone growth. When the body tries to heal injuries, instead of repairing muscle tissue normally, it deposits bone in the wrong places. This abnormal bone formation locks joints into place, restricting movements more and more as time goes on. People with FOP often experience flare-ups triggered by minor injuries or even infections, which cause painful swelling and rapid bone growth. There's no cure yet, and managing the condition means avoiding trauma and focusing on supportive care, because it's like your body is building a second skeleton inside you, slowly but surely. Foreign accent syndrome is a bizarre and rare neurological condition, usually following a stroke, traumatic brain injury, or other brain event. What happens is that the way a person articulates sound changes subtly, like a shift in rhythm, intonation, and vowel pronunciation, which listeners interpret as a foreign accent. The affected individual usually doesn't have exposure to the accent they acquire and often find it distressing or confusing. Speech therapy can help, but the condition can last months, years, or even be permanent. The first documented case happened in 1941 and was a Norwegian woman who was hit by shrapnel during World War II. She woke up speaking with a German-sounding accent. I'm sure that didn't go over very well. 60 to 70% of reported cases have occurred in women. Linda Walker, UK, 2006, after a stroke, she began speaking with a Jamaican or Eastern European accent. She had been to neither of those regions. Kay Russell, UK, 2010, Kay developed a French-sounding accent after a severe migraine. Sarah Colville, UK, 2010, sensing a trend, Sarah experienced a Chinese-sounding accent following a migraine, and an Australian woman, 2018, woke up with an Irish accent after tonsil surgery.